Good day, ma'am. I am Eunice J.D. Tabora and I will be your student nurse for today. I will be first checking your chart to see if there is any limitation on the patient's physical activity. Let's assume that I've checked. We check that to facilitate the patient's cooperation if the patients can move or to see the level of activity of the patient. Okay, next is perform assemble the equipment. I've already assembled all the equipments on the bedside organizedly. Next is perform hand hygiene. So after performing we do perform hand hygienes to ensure that we prevent the spreading of microorganisms. Next is identify the patient. So, ma'am, may I know your full name?
Alicia Brianna Tabora.
Okay, can you state your birth date?
May 29.
Okay, so in this procedure, ma'am, I will be doing bed making. So it includes changing of bed sheets, your blankets. Okay, ma'am. But before we start, I will be closing the curtains or closing the doors if necessary, if there is a door, to provide privacy to the patients. And also, next is I will now proceed to adjust the bed in a comfortable working height. Usually, it is the below elbow of the nurse. Okay, so having the proper height of the bed ensures that there will be no back pains or muscle crampings or muscle strains on the nurses or the worker. Next is let's assume that there is a side rail here. So before we proceed to the assessment, we will lower this side rail and we will lower this side rail nearest me so that I can move without any limitation. So I can change the bed sheets or do the bed making without any limitations. And having the we will also flat the mattress to ensure that it makes it easier to prepare the bed. Okay, so but first before I do all of that, ma'am, that I've explained to you, I will be putting on some gloves or put on PPE if necessary, if needed. Okay, so let me put my gloves first. This prevents, ma'am, the spreading of microorganisms. After putting all the gloves, I will be checking if there is connected anything that is connected to the patients and make sure to adjust it or remove it. And also the bell, we will be disconnect the call bell or any tubes, drains or from the linen or the bed linens. Okay, so since there is none, let's assume that there is none right now. I will be now placing the bath blanket on the patient. Put the after I place the bath blanket of the patient, I will be ask the patient to hold this upper part. Well, no, don't do that. So let's repeat the number, the ninth part of the procedure, which is putting the bath. So I will now proceed to place the bath blanket and over the patient, and have the patient to hold it. So ma'am, can you hold it? Until while I will be reaching it, I will be removing the top linen and leave the bath blanket. So ma'am, can you hold this, ma'am? Hold this po. I will now be removing this. Okay, so this will be put on a basket, and you should not put it anywhere or on the floor or any furnitures, so that to prevent contaminations, okay, or to prevent the spreading of microorganisms. Next is that after that I will be next is I will now assist the patient to turn toward the opposite side. Also, wait. So I will be assisting you, ma'am, to turn to the opposite side of the bed and reposition the pillow under the patient's head. So I will be repositioning it. So ma'am, kindly, I will not, can permission to touch you, ma'am. I will be assessing you. Can you move your body sideways? Thank you, ma'am. After this, as I will be now loosening all the top and bottom linen from the head and the foot side. So loosen everything from the head and the foot side. Okay. After that, this makes it easier to remove all the dirty linens on the patients. So next, after that, I will use clean linen. Next is I will use clean linen and make the near side of the bed. Place the bottom sheet with its center fold and in the center of the bed. I will just do the procedure and then explain it later. So I will be doing this now. I will now be placing the clean bed sheet or clean linen, and I will be doing some fan folds. So hot. After that, I will now use the clean linen, and I am done. Before that, I am done fan folding the soiled linen and close to the patient as possible. And next is in Rationale, this makes it easier to remove all the soiled linens when the patient turns to the other side. So I use clean linen and then I place it on the bottom and top of the bed and fold it in the fan fold. And I fold it I use fan fold method. Now okay, if the patient is using if the patient is needed draw sheet, you will put draw sheet in the center and also fan fold it like what we did on the red sheet. You must do it in the center and fan fold it. Okay. After this, we will be securely and tuck the sheet under the mattress. And then we will be tucking the sheet under the mattress, and also this we will be tucking it under the mattress. Okay. Next is the now we will be putting it the bed sheet and then this under the bed. Next is you will be raising the side rail and after raising the side rail we will be assessing the patient to roll over to the other side to the folded linen in the middle and toward me the bed. So I will be repositioning the pillow and that blanket or the top sheet and move to the other side of the bed and lower the side rail. To ensure the patient's safety, the movement allows the bed to be made on the other side and the blanket provides warmth and privacy to the patient. So let's assume that I will raise the side rail. assessing the patient